Could not be happier to have phase three starting tomorrow. We've been waiting for this. I want to thank Governor Cuomo for making the announcement today. I want to thank our entire Finger Lakes region for being such extraordinary teammates throughout the last 102 or 103 days with this process. We would not be opening phase three unless everybody really had been part of a great team effort. And that is from our groups, our control group, and all the leadership. It's our hospital systems. It's everybody, our elected officials, everybody working together, and most importantly, our citizens throughout a 9-county region. As to whether they like it or not, are still wearing masks, keeping social distancing. They are clearly adhering to the disinfecting, the hand sanitizing, the whole bit. And that's why our numbers are so low. Our infection rates are still about 1%. Our tests are going up. We've seen no spikes. And so we certainly applaud the governor making the announcement today. People are excited. And as you can guess, the two major issues are indoor dining and the personal care services. Nails, massage therapy, piercing, things like that. There's a number of those on there. You probably see those in the regulations. Step by step, we're opening, and there's not a whole lot more to go. And I want to also keep in mind that the governor has a penchant for in-between phases, continually opening up some of these areas and new areas as well. And for those that certainly are wondering what goes on here at the regional level, every single day we forward plans, suggestions, really thoughtful feedback from people to the governor's team. And as areas begin to reopen, as new guidelines emerge, time and time again, we can see some of that feedback directly part of those guideline changes. So the governor's team do listen. They're doing it the right way. Our infection rates are going down. You look around the country, some states, they're going back up. We don't want that. And we don't want to let our guard down. We want to make sure that as these phases reopen, we don't really lose the momentum we've had so far. We want to get to phase 4 and then and beyond and be fully operational as safely as we possibly can. So just very, very happy about today. Was expecting it. Our numbers are great and could not be happier. And it's one more big step throughout this whole pandemic process that the Finger Lakes region should be very, very proud.
We have some questions lined up. We're going to start with Andrew Banis.
Hey, Bob, thanks for taking a few minutes to speak with us. Asking specifically about making sure businesses are complying with these new mandates and who might be checking up to make sure they are doing that.
The enforcement aspects are really on local government. So it could be a town, a village, a city, a county would check on things. For the most part, people would respond to complaints. There could be a Department of Labor, could be state liquor authority, depending on the nature of the complaint, but by and large, it's local. And I would tell you the penchant for all of our regional elected officials is certainly if something is going on, it shouldn't, to give a warning. We don't want to see enforcement and maybe businesses further impacted by this. That's why we've been cautious. Don't open up too soon. Don't listen to people saying just open up anyway and violate the executive order or in many cases state laws or rules. We're doing it the right way here. So any enforcement would be at the local level, but we're hoping there's not going to be any. And we ask people, listen, if you have questions, call us. You can call me or us in the chamber. You can call your, again, county officials, the county executive, the mayor, town supervisors. Every county is represented in our control room. All the leaders are there, and we try and get questions answered as soon as we can.
If you have a question, please let me know in the chat function, and we'll call you in the order received. Next question, Randy Gordman.
Hey, thanks, Dan. Hey, Bob, how are you?
Hi, Randy.
So I know originally there was the governor, I think you've mentioned too, there was this recommendation that businesses have plans in place for when they were ready to reopen. I don't know if that's really a requirement, but did you, in your capacity as kind of like the representative for this area and also as being head of the chamber, did you get a lot of plans that have been submitted by restaurants, especially about how they're going to do this safely?
We have forwarded literally hundreds of plans to the governor's team. To the point where they probably hate hearing from us at times. I would say the Finger Lakes region has forwarded the most plans of anybody. I would challenge any other region to compete with us in terms of what we pass along. And those plans, as you see guidelines emerge, certainly are a reflection of what people are putting in there. Very thoughtful. Every conceivable area, the ones that are open, the ones that are waiting to be open in the future here, have submitted plans. I think the restaurants, you see the outdoor dining was approved, indoor dining is now approved starting tomorrow. In the changes that are being put forth, they've come from local restaurants, the Restaurant Association. We have listened, we have responded to them, we passed along their input and their plans, and I'll reinforce a couple of things. Yes, every business that opens has to have a plan in place. They have to self-certify on the state website, and they don't have to have it approved by the state before they open up. But if there is an issue, if somebody makes a complaint, if a complaint arises, if somebody comes, they should have that plan ready to show whoever that person is, just to reinforce that they were prepared.
Thank you.
Andrew Freeman has our next question.
Hi, Bob. How are you?
Andrew, how are you?
Good, thank you. My question is, so now we're 3 of 4 phases. Any word yet on malls? I know malls were kind of excited about phase 2. B, if not malls, are they going to be in the next phase? And then who else is left? And what's your message to those people that are just trying to hang on, waiting for that last phase?
Well, first of all, malls have not been announced yet, although stores in the malls who have an outdoor entrance can be used. And I've talked to mall operators, so any one of their stores that has an outdoor door or entrance to go in and out without accessing the common area are already open. They were open previously. We're waiting to hear about malls, and a lot of plans have been set forth on that. Waiting to hear about youth sports, fitness facilities. Those are big. Personal training. We're hoping to hear something in the not too distant future. I know is that we had a lot of that come up, but for the most part, those. And then I guess the biggest things are the large activities. I mean, the large crowd activities that there's been no rulings on whatsoever. I would not want to give any sense of when they may, at whatever level, would be approved. I don't know. We do send some very thoughtful plans. The governor's approval when he came down with House of Worship, 25% occupancy was I think a very good, thoughtful plan. Will that be applied elsewhere to other things? We don't know. We're waiting to hear. But we set these plans up religiously. What we don't do is publicize them. We send them up. The governor's team has been exceptional at receiving them, asking questions, listening, and there's a cadre of people working on these at the state level on these guidelines behind the scenes before they're announced and approved. As I mentioned before, what may not be announced so far in phase 3, nothing prevents the governor to come out at any point tomorrow or afterwards with any other updates before phase 4. And again, phase 4 would be at least 2 weeks from tomorrow, which would be at least in the area of June 26th. But again, every day there's been changes. The governor's listening. There's been continuous upgrades, which I think have really been great for people with businesses and for those that are just hanging on that have not been open yet. Call us if you've not reached out to us with your plans or issues. Let us know. We will follow up. And again, we don't get advance notice. We wait till the governor makes his announcement, so we don't really get a heads up when it's to be announced. But we try every day to listen to the governor's announcement, try and monitor what he's putting out every day publicly, and try to communicate that as quickly as we can to our region.
Patty Singer has our next question.
Hi. As things open, we're getting more people in closer contact. There's also been some issues with asymptomatic carriers and when they can be transmitted. With that being said, what is the level of increase in cases or hospitalizations or ventilator use that would trigger a slowdown?
Well, I think the governor's put forth his numbers, at least 30% bed capacity in hospitals. We look at ICU, intensive care capabilities, ventilators. We are so low in that usage right now. Our hospitals are doing phenomenally well, even with elective surgery. Our numbers are very low. Our infection rates hover right around 1%, a little less, a little more, depending on the day. We monitor these numbers daily. We have not seen spikes yet from our holiday weekend. We have not seen spikes yet from protests, although they take about 14 plus days to incubate and show up. But still, we have not seen those numbers yet. So we monitor those every day. We're on calls 3 days a week with the hospital systems, 5 to 7 days a week with our control room. So, every single day we discuss these issues. One thing I would say, Patty, is that for people, as we get into phase 3, don't let guards down. I mean, if you can't keep 6 feet apart, you wear a mask. You keep that social distancing. You wash your hands. You don't put your hands in your face, your mouth, and you disinfect surfaces. Do those things constantly. We do not want to see a spike. The Finger Lakes should be very proud. We have made great progress. We have been leading all the regions. First ones to be announced. Each phase, we're right there. So we should feel very good about what we've done. It did not happen by accident. It really happened with a lot of hard work, and just our everyday citizens and residents around this region have done a phenomenal job. Because whether they like it or not, they're adhering to these rules, and that's why we are where we are right now.
Thank you.
If you have a question, please let me know in the chat box. Rebecca Fath has our next question.
Hi, Bob. How are you?
How are you?
Good, thank you. So on a positive note, I spoke to a bunch of business owners today, and they were all just so thrilled. I mean, I talked to an esthetician, she does eyelash extensions, and she was brought to tears. People are really emotional, and they're also really taking this seriously with the measures that they're putting into place. And I mean, I just think it's a show of this community, the good. And I just wanted to hear your reaction to the level of, the way people have been cooperating.
Well, people have done a great job, first of all, and we love hearing good news because sometimes I'm not the recipient of that too often. So, we bear the brunt of the frustration and the anger here, but we work every day to get the word out. And you know what? I don't care what business you're in. The restaurants will now pick up the pace. They've been approved for outdoor dining, now indoors at half capacity. That's a great big step. And for the nail salons, all the personal care services right now, I do believe more will come. That's their livelihood. These folks, that's how they pay their rents, support their family. To have them open again is phenomenal. And the way they stay open is to follow the rules. I had my first haircut in about 3.5 months this past week. My barber had a mask on. And I'm glad to say we, as a chamber, we provided free face shields, 2,500 to be exact, to barbers and hairstylists, and also some nursing homes throughout the region, free of charge, thanks to Ron Ricotta, the CEO of Century Mold. He donated those masks. We passed them out, but everywhere I've gone, I've seen it. I stopped at an ice cream store outside of Rochester over the weekend. They had a sign, you could not come in without a mask. Unfortunately, I saw a family go up to the door, several kids, no one wearing a mask. They could not go in. They were disappointed. I usually carry a large supply in my car. I was driving my wife's car. I wish I had my car. I would have given them 10 masks right there, because I think that it's reinforcing this is how we get to the point of staying healthy. And listen, we have people every day. We hear all the bad news, people complain, and all the social media comments. But I'll tell you what, New York State should be proud. Whether they agree or not, the governor's done an exceptional job leading this effort. The phased-in approach does work. It's painful, but it's done in phases to prevent us from taking a step back and closing. And there may be states who went too soon, but if their infection rates skyrocket, they'll be in a much different position. And I for one, I don't criticize any state. Governors and leaders do what they think they have to do. But you really can't argue with the phased-in approach that our governor has led here, because it does work. And I could not be prouder of the Finger Lakes region. Our neighbors to the west, Buffalo, they're not open. They're not in phase 3 yet. We're in phase 3 tomorrow. They're at least a week or so behind us. Other areas of the state, other regions, the same thing. But we should be very, very proud. And it's the result of a lot of teamwork from every system. And the collegiality, the teamwork, the partnership, the lack of egos and turf that I've seen over the last 3 months here has been something that we are all proud of. And that's why we are opening in phase 3 tomorrow.
If you have a question or follow-up, let me know in the chat box. Patty Singer has a follow-up.
What is the sense of how long we will be wearing masks, if not the distancing? I have a sense as more things open, that 6 feet is going to start to shrink more. But what is the talk, the governor's office, of how long masks will be required in public places?
Well, I would sense at this point, not being a medical expert, I guess when I read on social media, we have a lot of medical experts here, probably thousands every day that have their opinions. I listen to the real ones, and I would sense until we have a vaccine or until this virus runs its course and leaves and disappears from our community, state, and country, we'll probably have to be adhering to these guidelines. And I look at news stories over in China and Wuhan, which was a center at one point, they still wear masks. And the biggest fear is this second wave coming. And, every year we get flu season. So every year the flu comes. So it's to be expected we will get a second wave. We don't want to see our hospital systems overwhelmed. And the stories I've heard, there's a varying degree of symptoms, but I've heard some horror stories about what this virus does to people, young and old. The debilitating effects it has on their bodies, the impact it has probably psychologically as well as physically is something I know I don't want to contract it. I don't want my family to contract it. I don't want my friends to have it. So I think we have that responsibility to keep ourselves safe. And I've said this before. I hate wearing a mask. I just do. But you know what? I wear it. I don't wear it in my car. I'm alone. I don't wear it when I'm 10, 15, 20 feet away from people if I don't have to. I go into a store. I go someplace where I can't socially distance. I wear it. I constantly wear it. And then, but I think the rules, CDC guidelines are not wearing it 24/7. It's just if you cannot keep at least 6 feet away from somebody. So that's really where we're at right now. So if you're running, there's no by yourself in a canal path or somewhere else in a road, not a requirement to wear a mask if you can't keep 6 feet apart. If you're out hiking somewhere on a path, if you're by yourself in your car, you're not required. It's just if you can't keep that social distance. But I would sense until there is a across the board sense of confidence in terms of that virus is gone. And listen, you know what? I don't think it's any sign of machismo not to wear a mask. I'm sorry. I mean, I get these comments. I'll go on record. I hate wearing a mask, but I do it. It's the right thing to do under these circumstances, and it's something we all should do. Show responsibility, but adhere to the rules and guidelines. And I go back to the point. That's why we're here. And it certainly is not a conspiracy of sorts because we apparently over 100,000 people have lost their lives over the last 3+ months. So I would say this pandemic has been beyond serious in so many different ways, and we don't want to see a return. And I do hope with the brain power that we have in this country that we see a vaccine that works, although those that predict we'll have one in a short time, I think are just guessing. Vaccines, you can't predict. I don't think we ever had one for SARS. HIV, we've not had a vaccine, although I think we were close in Rochester many, many years ago to having one. It never materialized. So we don't know when that will happen, but until we have 100% certainty or close to it, we have to take certain precautions. I think the ones that have been put out consistently are thoughtful and basic and ones that we'll adhere to until we hear differently.